Good morning, y'all. So Dr. Michael, board certified plastic surgeon. I hope y'all are all doing well. I wanted to answer this question. It's a great question about keloid scars after a tummy tuck. I'm a board certified plastic surgeon in Nashville, Tennessee. I have office hours today. I do surgery on Wednesday and Fridays. And so just giving you some background because I see a lot of patients with of different colors and ethnicities, y'all. Lots of women. And so a lot of my patients are actually prone to keloids a lot. And so I really think about this a lot in terms of scarring and things like that. And there are different ways to approach this. So to get to this question specifically. So if you develop a keloid scar after tummy tuck, there are several things you can do. Number one, you can do a scar revision. If I see any signs that a keloid is trying to develop, I will do steroid injections to help flatten it. So if I do a scar excision, I will remove the keloid scar, and then I will inject steroids at the time of removal, and I'll revise the scar. Let me tell you what, when I do that, almost 100% of the time, the keloid does not come back, believe it or not. The other thing you can do is, so there's several things I do in general. So I do a lot of things to prevent tension at the scar line with just certain types of stitching. Silicone starts at about week 2 to 3. That's silicone gel or silicone strips. And then the other thing too, let's say I see a patient who has keloids everywhere. Like we know they form keloids, right? So the protocol I just told you is a protocol I do just in everybody, right? Because I see everybody, and my goal is a thin line scar. In my mind, I imagine everybody is prone to keloids. Why? Because it just helps you keep the same protocol, but also helps you just get the best scar that you can get. Something else you can do, let's say it's like a severe thick keloid. I haven't had that happen. Or someone I know like has a lot of keloids. I will actually offer superficial radiation therapy. So that is a relatively new-ish treatment. And actually what's so neat about that is it's superficial. So you don't actually increase the risk of other malignancies, which can happen if you do kind of deeper radiation therapy. So there are so many things you can do for keloids. Being keloid prone doesn't mean you can't have surgery. It just means you should really be with someone in terms of your surgeon who really understands scarring and is going to be by your side along the whole time. You don't want to be in a situation where you develop a keloid, you're ignored, you're told that there's stuff you can do, because then you feel abandoned, and then that kind of affects everything. But there are things you can do. So it's so important. And ask your surgeon this. Ask what they do for keloids, and kind of go from there. I hope that helps. So my word of encouragement today is this. You might be in a situation that's really tough, really hard, a workout, obstacle, hardship. It's tough, but guess what? You're tougher. There's not any single situation in front of you that you cannot handle. Remember that. Catch y'all later.